So guys, this week we were talking about the functional pattern known as the squat. So for those of you who enjoy leg day, you will really enjoy the content series of this week. So the focus of today's portion of the squat series is your stances. What stance should you have when you squat? What does your stance mean? So on and so forth. So let's get going about that. Three things play a role in your squat stance. Your hips, as far as the mobility of your hips. Tibial rotation, how can you rotate about your tibia at your knee? And then, of course, your ankle dorsiflexion. Can your knee travel over your toe? So no two people, throwing out identical twins, have identical hip sockets, which means because everyone's hip socket is built differently, you will then be required to squat differently. So it's okay if your squat doesn't look like someone else's. So in addition to the different angles that your hip and ball and socket can be in, your hip socket can also be shallow or deep, once again further altering your preferred or most comfortable squat stance. So I just laid down a bunch of information. What does all of it mean? Number one, it means that you should not be squatting in a way that causes hip pain or discomfort. If you're doing so, that means something is wrong with your hip and or squat mechanics. Number two, keep listening. Sorry guys, due to me being so long-winded, we will have to talk about continue our talk about stances with the knees and ankles later on in the week. However, if you have more questions about the squat, feel free to ask me in the next story. Guys, one last tidbit of information. So the wider your stance in a squat, the more demands are going to be placed on the hip and less at the ankle. Inversely, the more narrow your squat stance, the more demands placed on the ankle. All right, everybody. Today we're talking about your knees in relation to your squat stance. So look forward to learning more about them knees. Everybody, so the knee is a hinge joint. So hinge joint means, if you think about a door opens and closes about a hinge. So knee technically opens and closes here, right? That's essentially like operating about a hinge. But there is a slight degree of rotation that occurs about the knee as well. Guys, we're going to talk about tibial rotation. So if you notice, I have a black spot where I've drawn on my knee, and it runs, and that's my tibial plateau bone. And that's to show you an indicator where that bone is in relation to my ankle and my hip. So I'm going to step on a band. Here, I'm going to grab hold of this band. I'm going to crush the band with the big toe, try to pull the band away, and make sure I apply force to the ground. From there, I'm going to send the knee outwards using my hip. So my hip is doing this. We're externally rotating at the hip, doing this. But if you notice, my tibia has to stay where it is. My toes are pointing forward, so my tibia then has to rotate this way to counteract the torque this way of the hip. So we call this tibial rotation, and thus there is rotation that occurs at the knee. Everybody, so the amount of toe flare you have in your squat determines how much tibial rotation you need. So for me, I have very little tibial rotation. So a wider flared stance means my tibias don't have to rotate. If I go narrow on a squat like this, that means I will need a lot of tibial rotation to be able to perform the movement, or the squat specifically, properly from this specific angle of my toes being forward. So everybody, that concludes today's content series about squat stance in relation to your knees and whether or not you should and or can flare your toes. Now, if you have any more questions with regards to squat, make sure to leave them in the next story. All right, guys, today's the last day of the content series, and we're going over your ankles in relation to your squat stance. Hey everyone, there's two important ranges important to the squat. So you have ankle dorsiflexion, which is the ability to pull your toes towards your shin that allows knees to go over toe. Then you have ankle plantar flexion, and that's this motion here, and you think that's more so the direction of the calf raise. So ankle dorsiflexion and then ankle plantar flexion are the two important ankle ranges. So the width of your stance actually determines the demands of the ankle. So what that means is the more narrow your stance, the more your knee is going to have to travel over your toe. The wider the stance, the less knee will have to travel over the toe. Hey everybody, we're talking about squats and stances. So the first stance I'm going to show you is a wide stance. The wider stance does not require as much ankle dorsiflexion to perform. So I'm here, my knee did not have to travel from my toe to make that happen in this super wide stance. Let's say I go narrow, and then I squat. Much more demands knee over toe in this variation of the squat with that narrow stance. So guys, keep that in mind when selecting your squat stance.